Alprazolam, also known as Xanax, is a medication used to treat anxiety and panic disorders. It falls under the category of benzodiazepines, which work on the brain and nerves to create a calming effect. It achieves this by increasing the effects of a specific natural chemical in the body called GABA. Make sure to read the medication guide given by your pharmacist before you start taking Xanax and every time you get a refill. Take this medication by mouth as directed by your doctor. The dosage is based on your medical condition, age, and response to treatment. Your dose may be gradually increased until the drug starts working well. Follow your doctor's instructions closely to reduce the risk of side effects. This medication may sometimes cause addiction, especially if you have a substance use disorder. Take it exactly as prescribed to lower the risk of addiction. If the medication stops working well, talk to your doctor. Let your doctor know if your condition lasts or gets worse. Some common side effects of Xanax include drowsiness, dizziness, increased saliva production, and changes in sex drive. If you experience any of these effects and they persist or worsen, it's important to let your doctor or pharmacist know. To minimize dizziness and lightheadedness, it's recommended to get up slowly when rising from a seated or lying position. Remember that your doctor has prescribed this medication because they believe that the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects, but it's important to contact your doctor if you notice any changes in your mental or mood, trouble speaking, loss of coordination, trouble walking, memory problems, yellowing of the eyes or skin, or seizures. Although it's rare, a very serious allergic reaction to Xanax can occur. If you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Alprazolam can be addictive and can cause overdose and death, especially if taken with alcohol or other drugs that cause drowsiness or breathing problems. Your doctor will prescribe the smallest dose for the shortest time to lower your risk. Make sure you know how to take alprazolam and which drugs to avoid. Seek medical help if you experience serious side effects like shallow breathing, severe drowsiness, or dizziness. Suddenly stopping this medication can cause serious withdrawal symptoms, especially if used for a long time or in high doses. Your doctor may lower your dose slowly to prevent withdrawal. Let your doctor know if you have any withdrawal symptoms like headaches, trouble sleeping, restlessness, or depression. Withdrawal symptoms can last weeks to months. Before taking Xanax, inform your doctor or pharmacist if you have any allergies or if you are allergic to other benzodiazepines. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Discuss your medical history with your doctor or pharmacist, especially if you have lung or breathing problems, liver or kidney disease, or a personal or family history of substance use disorder. Xanax may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. Avoid driving or using machinery until you know how it affects you. Inform your doctor if you are pregnant or plan to become pregnant, as Xanax can harm an unborn baby. It can also pass into breast milk and may have undesirable effects on a nursing infant, so breastfeeding is not recommended while using this drug. Older adults may be more sensitive to the side effects of Xanax, which can increase the risk of falling. Also, inform your doctor if you are using any other prescription drugs, non-prescription drugs, or herbal products before having surgery. Drug interactions can change how your medications work. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xanax include kava and sodium oxybate. Other medications can affect how Xanax works in your body, such as adagrasib, azole antifungals, cimetidine, certain antidepressants, protease inhibitors, macrolide antibiotics, rifamycins, St. John's wort, and drugs used to treat seizures, among others. There is an increased risk of serious side effects if Xanax is taken with other products that may cause drowsiness or breathing problems. This includes opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, and antihistamines. Cigarette smoking can also decrease the effectiveness of Xanax, so be sure to inform your doctor if you smoke or have recently quit. If someone takes too much Xanax and has serious symptoms like passing out or trouble breathing, it's important to call 911. Otherwise, call a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, slowed reflexes, slowed breathing, and loss of consciousness. Sharing Xanax with others is illegal. It's important to have lab and medical tests, like checking your liver function, while you are taking this medication. Make sure to keep all your medical and lab appointments and talk to your doctor for more information. If you forget to take a dose of Xanax, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Keep Xanax at room temperature, away from light and moisture. Don't keep it in the bathroom and make sure to store it out of reach of children and pets. Don't flush Xanax down the toilet or pour it into a drain unless you're told to do so. When the medication is expired or no longer needed, make sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.